I now hand over the session to Shanthini for our educational session. Here, Fireside Chat with Dr. C.K. Ballal. Just as neurosurgery demands precision, focus, and tenacity to eliminate the most delicate pathway, this dialogue will open now the new horizons of clarity and growth for our hive.
Thank you, Raji, for the introduction. Good morning, everyone. So it
Good
gives me an
morning.
absolute privilege. Good morning, sir. Yeah. So it's a privilege for me to interview you today. So, Doctor, you are a unique guest for us as you bridge the world of neurosurgery and public speaking and leadership skills. I would say you have reached the pinnacle of your profession and passion, a feat that requires immense dedication. So, to start with the first question, so you are both a neurosurgeon and a triple distinguished Toastmaster. So, what inspired you to pursue excellence in two seemingly different worlds?
First of all, let me thank you all by having me in this group discussion or an interview. It feels as if it's like a coffee with Shantini, as they say. So, coffee with my hivers, with a little bit of honey added to my coffee to make it sweeter, all the more sweeter because it's already sweet by interacting with all of you. They talk about what helps me to take ride two horses at the same time, quite diverse, and as you would probably like to say, it does require some kind of tenacity because you have to entirely different fields as some would feel it, but I don't think they're entirely different fields because it is a basic tendency of all human beings like all of you to excel in whatever you do. So communication is exceedingly important for doctors and particularly for a surgeon. Excellent communication skills have helped me in my field as a neurosurgeon in communicating with my parents, because with my patients and their parents when they're small children, because it's of utmost importance, and that's what's lacking in the medical field a lot, and that leads to a lot of misunderstanding, as you would have read in the newspapers, between doctors and patients. To bridge that gap, you need excellent communication, particularly when you have to counsel patients and break what is known as breaking bad news. When somebody has something like cancer or a brain tumor, the word itself, brain tumor, make sends shivers down your spine. And to be able to convey a news like that to a young person or an older person about having something that is could be life changing requires a lot of tenacity on both sides, for the doctor as well as for the patient and his family. And that is what has helped me really. I've married neurosurgery and communication skills, toast mastery, and try to lead a balanced life, I must say. Thank you.
Thanks, Doctor. That was an interesting perspective. Yeah, moving on to the next question. So, in neurosurgery, so decisions can be life altering, right? How do you stay calm and clear under extreme pressure?
Yeah, it is basically the training and the mentoring over several years that helps you to stay calm in the face of storm and stay clear of any kind of obstructions that might come your way. It is the mentoring. Just like in Toastmasters, we too in neurosurgery have mentoring. And it is our teachers, our professors, people that we hold in high esteem and look up to, that somehow unknowingly teach us to be calm and clear and precise. One, over the years, as you would have seen, one tends to mirror his mentor. So also in neurosurgery and in Toastmasters, you kind of Mirror your mentor. The mentor has to show a mirror to you when you go wrong. At the same time, you see your mentor and look at him, and somehow unknowingly and perceptibly, you start kind of copying them, unknown to you. And you become like him, sometimes almost as if you've been cloned, not physically cloned, but in your behavior. So it gets modulated. And I think what is important is to look up to someone that you hold as a role model. And therefore, it's very important to have the right and choose the right role model in life. And if you choose the right role model, you will be able to stay calm and clear, even in competitions, for example, in Toastmasters. If you have good mentors and you look up to them, you see how they prevent butterflies flying in the stomach, in a haphazard manner. And you try to make them fly in order, like the birds which fly during, when they're homing in the evening. You see them flying in a kind of pattern. And that pattern somehow becomes your life. And you stay calm and clear. There may be somebody shooting at the birds with a gun or with an air gun, and for a minute they go helter skelter, and then they again fall in line. So I think it's experience, years of training, having good mentors, and to summarize, and somehow kind of look up to them and live your life as they would and they do.
Thanks, doctor. I think it's not letting the situation handle us, right? We handle the situation.
Absolutely, you're right.
That's interesting to know. So moving on to the next question. So even accomplished professionals experience fear. So
Yeah,
what
yeah,
practical advice would you give for someone who feels nervous when they speak in front of audience?
yeah. Well, I think it's a basic human nature. And my boss and even my father, who was a retired eventually as director of English news in All India Radio Delhi, used to say that a bit of nervousness is good because that helps you prepare better when you're preparing. A little bit of nervousness, but that nervousness should not overcome you. You should overcome the nervousness. It is the fear of failure that leads to nervousness. It's the fear of letting someone down, like your mentor, because you think you've been watched all the time, and sometimes even letting down yourself. And that is what leads to failure, fear of failure, and nervousness. Think when you're nervous as to what could be the worst scenario. What can happen? You may not come out as the best, you may not come out as the champion, but then always gives you many chances. So you live for another day, you face another situation and better yourself as you go on. But under the circumstances, always give the best you can. And you can only give the best when you prepare to the best. And the Gita Upadesha always comes to my rescue. It says, Karmaneya Vadisha Ma Phaleshu Kadachana, which means that you should work the hardest, the best that you can. Put in the best effort, and the result will follow. When life, as they say, throw limes at you, you learn to make lemonade out of it, and make it the sweetest lemonade possible through your hard work. I'm sure when you make your Mysore masala dosa, or if you want to say Madras masala dosa, you always want it to come out the best, don't you? So if your dough is right, if the salt is right, if everything else is right, it comes out the best. But then at the same time, there should be people around who encourage you and help you overcome the fear and nervousness. It happens in neurosurgery also. it is like the margin for error is very little in fields like neurosurgery and in cardiac surgery. Neurosurgery even more, because a little bit here and there can make things go wrong. But then you train yourself, and when you train well, when you prepare well, the fear of failure and the nervousness becomes less. I can't say it can go away completely. It can become less and helps you to bring out the best that you have in you.
That's nice, sir. Like when I hear you, I just remember this quote in Bhagavad Gita, same kadame sei palane edirparkade. So
Yeah.
yeah, so that's true. Thanks for reinforcing that. Yeah, we are moving ahead with the next question. So if you had to name one communication skill and one leadership skill which has made a biggest difference in your journey, so what would that be?
Yeah, I think what I've learned from Toastmasters is learning to listen. I find that I lacked it. I lacked it when I started in Toastmasters, and learning to listen to another person, because I was always quick on the ball. I wanted to have the first word and the last word all the time. And my wife always says, why don't you listen? Solpa keli in Kannada they say, listen a little bit. In Tulu, which is my mother's name, onte keni, porlude keni. It's very similar to Tamil. Onte means little bit, keni, listen. And listen carefully, and that also brings out the empathy that you would have for others. So I think listening is the skill that I'm continuing to try to master, but I think I've come a long way. But in leadership, you said, is I feel it is understanding a situation from another's point of view. That's what I found. When you look at a situation from another's point of view, it makes you a better leader. For example, if you set a target for someone, and so you should not do micromanagement. The person might have been busy. Give him a little bit of a chance, once or twice, and then a tinkle, and then you take it further. Understand from his point of view, and once you try to understand from another point of view, you become a better leader, and you set high standard for him, and he also becomes a better leader eventually. So these two basic skills, in summary: learning to listen and learning to understand another's point of view, particularly when you set a target for someone, makes you a better leader. I don't know whether you're convinced with but I've found that it works. It has worked for me because I used to be a very tough taskmaster, particularly with my students, and also tough on myself. I virtually would do what is known as self-flagellation. Uh, you might have seen in taziyas that the Muslims take, the Shia Muslims. I used to punish myself and make myself miserable. Then I kind of learned, give yourself give yourself a chance, man. I used to say to myself, and so I learned to give chance to others as well.
That's good to
Thank you.
know. I think it's always understanding the self-awareness, right? What I am missing and then how I can learn. So I think that's what these communities help us with that. Yeah. Thanks, doctor. Yeah. So then the last question for the session. So you have the experience of saving lives and shaping leaders. So what is one message that you want all of us here to carry forward?
Well, I would say two qualities actually, rather than message, which I think one should strive for, is empathy and tenacity in the face of challenges. You should have, only when you have empathy for others, And for patients, it helps you to save lives and do your best. If you don't empathize with them, if you're not, you cannot be one with them. You cannot understand what they're going through. When you realize what they're going through, it helps you to save lives. And even when you can't save a life, they understand that you've done your best. After all, we are humans, and it's. I don't think anyone is infallible. Sometimes it's not your fault. The disease itself is so bad that you cannot save everyone. And therefore, the empathy, even in the face of loss, even in the face of suffering, helps you and helps the patients to understand that you understand them. There's a song in Hindi. I don't know how many of you are Mukesh fans. You know, it is said, किसी की मुस्कुराहटों पे हो निसार. You know, if someone is smiling, you enjoy that smile. किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द हो सके तो ले उधार. Take another's pain as a loan to yourself. किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है. Do you want me to translate it for you? किसी की मुस्कुराहटों पे हो निसार. You kind of give everything for someone's smile. किसी का दर्द हो सके तो ले उधार. Take another's pain as a loan to yourself. जीना इसी का नाम है. That is what life is all about. Thank you.
Thank you, Doctor. I think we have 2 bonus questions for you from the audience.
Bonus,
So
I
are you-
always feel as if I'm on a pin cushion. Yeah, go
so
on, fire them on. Yeah.
yes. So first question is from Ilavenil, where she says, how does a leader stay empathetic while being strict?
Yeah. You could be a strict person and yet have empathy, because strictness doesn't mean being being rigid in your views. You know, you set a high standard and they know that you're strict. But having empathy, I would just give you an example. For example, when I have my students are much older than the routine student. They're postdoctoral students, they're MCH, and they're doing PhD and all that, and they're much older, and therefore they have their own problems, they have their own they have their own issues, and they know I'm strict. But then having empathy and understanding them and setting a high standard helps me both ways. And they meet up, they rise up to the occasion, I find. But you have to be strict on yourself also. You can't say, they say, do as Papa says, not as Papa does. But then Papa has to also do things right. You say come in time and you reach the operation theater at 8:30 and you expect them to come at 8. Well, that's just not good enough, you know. So as I say, lead by example. Lead by example. So they know that you're strict and that you expect high standards.
Ilavenil, are you convinced, Ilavenil? I see Ilavenil
I am
nodding.
convinced. I am convinced. Do you remember me, sir, by any chance? Because I was in
Uh,
Mysore.
You're in Mysore.
I was
Okay.
in
I
Mysore
remember the
Toastmaster.
name because it is an
Yes,
unusual name.
yes,
I'm trying to understand the meaning. I don't know whether you remember that I asked you what is the meaning of the name.
yes, yes.
Yeah, this is
Because
an
I had,
old Tamil name, and
yes, yes.
from Tamil. I'm trying to translate it into Tulu. Okay.
Uh,
Go on, tell me the
uh,
meaning of your name,
yes.
so there's no curiosity on my mind.
My name means the spring season, sir. And
Eh?
I think
Spring
the season
season.
spring, yes. And we
Okay.
had this conversation right after I gave a 7-minute speech on how people murder my name when I'm out of Tamil Nadu. So
Yes, so that's how I
I
remember it.
I have seen you as a chief judge, sir. The last
Okay.
year I was in Toastmasters, you were the chief judge of T92. So that's why I asked you that question. Because you're so down to earth and you're so empathetic when you're talking to us. But that year the rules were enforced quite well, very, very well. So that is why I wanted to hear this from you. And yes, Shanthini, I am convinced. Thank
Yeah,
you very much, sir.
that is why people misunderstand me sometimes. I've got a very hard exterior, but a soft center, like that chocolate.
That's nice to know, sir. Sir, one last question and we'll wrap this up. I'm just modifying Bharat's question a little. Say, human brain, right? Is there any interesting fact that we don't know that you want to tell us about human brain?
Well, I think a lot of you have probably read about it somewhere or the other, that we only use about 25 to 30% of our brain
Hmm.
at all times. So a lot of it is silent. And the question that is asked to follow this is then how to use a lot of your brain more. You see, God
Yes.
has given us many more neurons than we need, because from the age of 25, you'll be surprised to know that we start losing our neurons. Okay, we start losing our neurons because that's a natural process. But at the same time, we have what is known as plasticity of the brain, and that's what helps patients with stroke, patients with brain tumors recover. There's a lot of brain there, and therefore you have an umbra and a penumbra whenever there's an insult to the brain. So the surrounding cells start taking over the function of the area that is injured. So if there's no scope, you would have heard that there's no regeneration of brain cells. For example, when I cut myself by shaving, very soon that skin grows again. Okay, you have a small burn there, the skin falls off, but then it grows again. Fast dividing cells. In brain, there's no, it's a myth, of course, now been proved, there's no regeneration of the neurons. Okay, so therefore what happens is get a scar tissue, you get glial tissue and fibrous tissue. So then how does recovery occur if cells don't regrow? Because there is what is known as plasticity of the brain, transfer of function within the brain, and now we know there's a bit of regeneration because cells which are towards the middle part of the brain, lining what is known as the ventricles, they migrate to the periphery along the nerve tracts and go to the area where they're needed most and help in take over the function of the cells which are there. So there is regeneration from what are known as the basic germ cells, which can go into perform any function. So the myth that people have or a misunderstanding is that there's no recovery in the brain. Once gone, gone forever. It's not like that.
That's
Okay.
good to know.
Yeah.
That's good to know. Yeah,
എല്ലാവർക്കും
thank you, sir.
സാധ്യതയുണ്ട് റിക്കവറി ചാൻസ് എല്ലാവർക്കും സാധ്യതയുണ്ട് ഓക്കെ
Super. Thank you, sir. I think that brings us to the end of the session. We really appreciate you took this time to speak with us. Yeah. And
I enjoyed it. Thank
yeah,
you very
thank
much.